All right, are we on? We are on week 3, you guys. We're going to talk about lunges this week. So, super functional, important exercise, and one we see people doing either incorrectly or avoiding entirely because of pain or just not being able to do it correctly. So, we're going to talk about that. Now, certainly, if you have an injury like a meniscus tear or an ACL or something like that, you're not going to be doing lunges at this time. But even if you have maybe arthritis, we can help you modify your lunges so that you can get to a place where you can do this movement without pain. So let's talk about it. Appropriate form. We want to see a 90-degree bend in both of those knees. So front foot, nice step back for that back foot. When I drop my hips down, my front foot or my front knee is creating a 90 degrees angle, and my back knee is creating a 90-degree angle. And I'm hovering with my back knee just above the ground. Okay, so look how far apart my feet are in order to get into that 90-degree position. It is not unusual to see people either too short, so end up looking a little bit like this, a lot of pressure on my Achilles, on my calf, my hips are angled back. I don't have that appropriate 90-90 in my knees, and I can't just drop my hips down. It pushes my hips kind of back into that hinge position. Or way too big, so my back leg is going to stay almost straight, and I'm lunging in this awkward wide leg lunge, but no bend in my back knee. Pretty typical to see that. So we really want to make sure that you have the appropriate spacing between your feet so that you can see that 90-90. You may have to video yourself to get into this position so you can see what it looks like and then practice what that feels like, especially if you've been doing it incorrectly for a very long time. Most people will either go way too short or way too long. Now, the other thing that's really common is where my feet are laterally to each other. So if I'm just standing neutral here, my feet just in line with my hips, there's some space between my feet. What people will do with lunges, when they take that step back, they take away that space and they bring that back foot right behind that front foot, and it causes a lot of balance issues. You don't have to be on a tightrope, okay? We can still have this regular spacing between our feet. So think you're on skis, not a tightrope. So when I take that step back, I still have that space, so I can drop my hips down. I have more stability, especially if you have those cushy running shoes. That's why shoes are important. Okay, when we take that step back, going for that 90-90 degrees, I just really want you to think about just dropping those hips down. People will, depending upon if it's a reverse lunge or a forward lunge, push their weight back or forward. So that forward lunge can get really challenging as you're taking that step forward, driving that knee over the toe. And now I'm not in a 90-degree angle anymore. I've shortened that versus here where I'm dropping my hips down low. So if we are challenged with that forward lunge, number one, you're going to take the weight out. You're just going to do body weight movement so that we can take that step forward, and we're going to go slow. There's no rush to get into this movement. Take that step forward, make sure that our feet are appropriately spaced, and still drop those hips down. Once we get better at this, then you can either add weight or go a little bit faster so that we're not shifting our weight forward into that knee. Okay? Real quick, for people who have a hard time or have arthritis or are just starting to work out and those knee joints are starting to ache, it is not unusual for that connective tissue to take a little bit longer to build up. So people tend to get a little bit sore and then they just avoid the movement altogether. We don't want you to necessarily avoid it, but we can shorten it and we can lighten it. So we're always going to take the weight out, and then you can add support in the way of bands, the wall, suspension trainer. So when things are out like this, I encourage you to come in and use it. So if I'm somebody that has arthritis in my knees, I might come and hold on to whatever band or bands I need to give myself a little support in the upper body so that all my weight is not coming down on my knees, right? And now I'm going to come down as far as I comfortably can right now, and then work my way to get down to that 90-90. Another very important piece for lunges is strengthening your glutes and your hamstrings and your quads. Having the strong muscles to be able to do these exercises is super important. So it's not just about your knees. It's about all the muscles that we are using while we're doing it. And a lot of people have underactive glutes that we need to strengthen to help you with these exercises. So come in, grab the bands, get your support, get a trainer, ask them to watch your spacing, and then slowly work our way down and back up. Okay. There was one other thing I was going to say, and I can't remember what it is right now because words are hard. So maybe I'll add to the rest of this in just a second. Otherwise, let's practice our lunges this week. And week 3, guys, let's get after it.